Hello and welcome to lyranara.com and lyranara.me, the place where you can find the most advanced and effective holistic diagnostics and treatment devices, as well as the most efficient holistic natural remedies and supplements available on the market today. And in this video, we're going to continue with talking about cardiovascular diseases, heart attacks, the myth around them, how to prevent it, and a great natural supplement that can help you maintain your cardiovascular health and avoid heart attacks. So today's presentation is titled Catheters and Stents, Illusion and Reality, and we're gonna clear up a lot of the myth surrounding heart attacks. We're going to show you real images of a heart with blockages and which are supposed to lead to a heart attack. And we're going to tell you what doctors know about heart attacks nowadays. So without further ado, let's dive right in and learn more about how you can maintain a healthy heart. And I would like to start with this amazing short video of a heart that suffers from a so-called stenosis, which is a bottleneck or blockage of your coronary arteries. And you're going to be amazed about what you're going to learn here. So let's listen in, and then afterwards we're going to talk about the whole video in more detail. In this short video, the right coronary artery, here on the left side of the picture, is filled with a contrasting agent through a heart catheter. The main and important result of this examination beforehand, for your better orientation, we find a bottleneck in the middle section of the artery, a so-called stenosis. And now to the coro video. Let's watch this again. Now let's look together at some freeze frames taken from the coro video so that we can study the individual results together. Here the first frame. In the marked area you see the heart catheter with its curved tip, without a contrast agent still in it. Now the artery becomes visible through the contrast agent. You can see it in the upper part of the picture. This frame is the most interesting of all. Why so, you will rightfully ask. It's because of the marked area in the lower part of the picture. That's a contrast agent in an area far behind the stenosis. We see no sign at all of the bottleneck, yet a section of the coronary artery that is far away is filling up with the contrasting agent. Here we see the first signs of the stenosis in the marked area. The same picture again. The bottleneck starts to become visible through inflow from above and below, especially from below. It becomes more clear. This stenosis blocks almost any drop of blood from passing through. Almost nothing passes through the bottleneck. Hence, it is not like you would imagine as a layman that the blood forces its way through the bottleneck and is thereby filling up the lower part of the artery. You can see clearly that the lower part of the artery is well filled with blood. So where does the blood come from then? Even though you don't see exactly that the blood is coming from the collateral arteries that surround the bottleneck in this picture, this test clearly proves their existence and effectiveness. And here the whole picture of a blockage of about 90%. Unfortunately, we can't observe the vast network of collateral blood vessels with this method. Considerable misinterpretations about the significance of the artery bottlenecks are the result. Through the very narrow pathway, through the stenosis, a little blood passes from above and from below. In the bottleneck itself, the blood is almost at a standstill. So if the bottleneck is closed completely through a blood clot, a so-called thrombosis, what happens then? Is the result a heart attack, as it's generally believed? By no means. The blood is already at a standstill, so a full blockage of the stenosis would have no further effects. Nothing would change. You can't have it more clearly. The blood circulation in the area affected by the bottleneck is absolutely undisturbed. The right coronary artery is clearly visible in this picture up to its fine branches. The heart muscle suffers no damage from the bottleneck. To better get acquainted with the invisible collateral vessels, have a look again at the whole video. Very interesting to see, I'm sure you will agree. So let's talk about what this video has shown you in a little bit more detail. First, let's start off by talking about heart catheters and stents. So cardiac catheterization is a procedure used to diagnose and treat cardiovascular conditions, and during this cardiac catheterization, a long thin tube called a catheter is inserted into an artery or vein through your groin, neck or arm and threaded through your blood vessels to your heart. Cardiac catheter is performed to find out if you have a disease of the heart muscle, valves or coronary arteries, and during the procedure the pressure and blood flow in your heart can be measured. Coronary angiography is done during the cardiac catheterization. A contrast dye, as you have seen in the video, visible in X-rays, is injected through the catheter, and X-ray images show the dye as it flows through your heart arteries. And this shows, as you've very nicely seen in this video before, where your arteries are blocked. Coronary stent is a tube-shaped device placed into your coronary arteries that supply blood to your heart, and it keeps the arteries dilated and lets the blood flow through the arteries. It is used in a procedure called percutaneous coronary intervention, or short PCI. A cardiac stent is considered by classical medicine a sacrosanct tool to avoid heart attack and improve life quality. But is it really so? To answer this question, let's look a little bit more in depth into the illusions and the reality of this whole procedure. So a balloon and stent are used in two different ways and for two different cases, better said. First, patients with a chronic stable angina. Patients who have constant reduced heart capacity and intermittent heart pain, inhibited physical activities, and are resilient and not loadable. And second, patients with acute unstable angina, which are patients with acute heart pain, heart weakness and cardiovascular disorders that are threatened by a heart attack. In a study published by the Mayo Clinic in 2003, you can read about the following. A balloon and stent are used to improve symptoms in case of heart weakness and angina pectoris. A balloon and stents cannot avoid a heart attack, and there is no guarantee that your life is going to be prolonged by this procedure, unfortunately. Stents prevent a coronary vessel narrowing and restriction, but it does not reduce the number of heart attacks and heart deaths. Catheter and stents can trigger new lesions and bleeding in a blood vessel walls, and thereby they can enhance the danger of a heart attack. Actually, that's what the Mayo Clinic found out by flattening and squeezing the arteries. In 1990, the catheter and stent became a regular procedure which was applied to all patients with an increase in STEMI. And STEMI means non-ST segment elevation myocardial infarction. It may also be defined as a development of heart muscle necrosis, which is a form of cell death. So the assumption of medicine today is that the ST segment elevation that results from acute interruption of the blood supply to a part of the heart can be demonstrated by an elevation of cardiac marker called troponin in the blood. And an STEMI is the less severe type of heart attack compared to a STEMI, which is an ST segment elevation myocardial infarction, in which the full thickness damage of the heart muscle develops. And this is unfortunately has been proven to be wrong, and let's see why. So the marker troponin is increasing in blood not only in the case of a heart attack, but also in the case of acute angina pectoris, arterial fibrillation, high pulse for a longer time, and stress caused by an adrenaline discharge. Only 50% of the troponin marker increases from a total of 96 of the heart attacks, and two cases that demonstrate how wrong it is to use troponin or troponin increase as a reason to apply to stents are: first, a patient has an angina pectoris attack, which usually disappears after 10 minutes without any intervention, except for the administration of Strophantin. In this case, troponin is increased but decreases very quickly thereafter. Angina pectoris is no heart attack and does not destroy heart cells. This is a misconception that has been proven wrong. In an emergency room, this is an STEMI case, and immediately a catheter or a stent will be prescribed and used in such a case. Unfortunately, patients are wrongly diagnosed with acute heart attacks instead of angina pectoris, which is a temporary heart vascularization problem without the heart cell necrosis or the death of heart cells. Second, a patient comes to an emergency room with pain in his chest, actually due to climbing stomach acidity. Pain chest is always a risk factor for a heart attack, and the patient is kept in the hospital. Therefore, the patient unquietness triggers an adrenaline shock discharge, and the troponin value is raising, and therefore the patient is getting a heart catheter, which in this case, unfortunately, is pretty much useless. Third, the legitimation of heart catheters and stents today as a standard healthcare procedure is only based on troponin increase without a clarifying ECG. The fourth, also, the majority of people living in industrialized countries have arteriosclerotic changes in their coronary arteries, so the doctors always find during a heart catheter alarming changes in the patient's coronary vessels. And STEMI is the scary diagnosis, and the stent comes closer with all its related risks, unfortunately. Strophantin, on the other hand, would have done the job much better and without any side effects, but unfortunately, patients are not being told about this very simple, natural, side effect-free method. A British clinical study known as RITA-2 and RITA-3 analyzed the uselessness of catheters and stents in acute and STEMI cases, especially in preventing deadly heart attacks. In this study, there was a comparison for 100 patients that had the catheter and the stent therapeutic effects, and they were compared to the Strophantin or Strophantin therapy, and the results were that 3 out of 100 patients died that received a catheter stent, and over 92 were living for many years with a Strophantin therapy on the other hand. A Dutch study known as ICTUS came to the same conclusions as the RITA study. Moreover, for 10% out of 1,200 patients who received a heart catheter or a stent, it induced even a heart attack. So as you can see also from the 2 pictures below, and you have seen in the video at the beginning, nothing changes before and after the stent therapy. It cannot do, as you have seen in the explanations. The blood circulation is the same because all of your collateral vessels take over the function of the blocked artery. So going back to our previous presentation, which I highly recommend if you haven't watched it yet, it's called Strophanthin, the Heart Elixir. It's on YouTube channel, of course, and I'm gonna post the link below in the description box so you can have a look at it. I highly recommend it, as I said. and it's about Strophantin and how a heart attack occurs. In this presentation, you're going to learn that not a blood clot in the coronary arteries is the real trigger of a deadly heart attack, as you have seen also in the introduction video here in this presentation, but much more the destruction of the left ventricle wall cells due to a high acidity and therefore the resulting fermentation process, which translates into a lack of oxygen. So we highly recommend that you go with a natural cure that has proven itself to work over and over again for decades, which unfortunately has fallen out of favor due to the fact that Strophantin cannot be patented and there isn't much money to be made out of it. But it's clearly proven itself over and over again to be much more efficient for cardiovascular diseases and maintaining a healthy heart. And you can get the most concentrated and pure form of Strophantin exclusively at lyranara.me. I'm going to post a link, of course, in the description box below. So I hope that you maintain your heart in a healthy state with Strophantin. Give us a call if you have questions, of course, 1-888-773-3196. We love to hear from you. Share, like, and subscribe. And until the next time, stay healthy.